morning, everyone. My name is Wendy Adelson. I'm a clinical professor at Florida State University College of Law. I direct a clinic at Florida State called the Medical Legal Partnership. And what we do is provide free legal services to patients at a community health clinic. We focus primarily on immigration, and a lot of our immigration cases do involve human trafficking, as well as disability benefits. And I get to teach the law students about how to become public interest lawyers, so there's more lawyers that people can tolerate all around the state and around the country. Dr. Alonso.
Well, hi, my name is Alina Alonso, and I am a physician by training, public health by choice, and I'm actually the director of the Palm Beach County Health Department, and which is what most of you still remember it as, but we have rebranded ourselves, so now you will hear Florida Health Palm Beach County. So keep that in mind when you see the new logos, and that's it up there, so recognize that. It's my pleasure to be here. We're going to talk a little bit about some of the data so that you understand what we're dealing with, and then some clinical information, what to look for, and I hope it makes it useful for you. And please interact with us, because we like to keep talking. We're talkers, okay? So we'll go ahead and
we're going to start with Dr. Alonso. I'll bring up the rear, as it were, and then we'll field questions that you have. But feel free to ask questions throughout.
Okay, so how many of you are here from law enforcement? One. The rest of you won't admit to it. Okay. How many of you are here from health? Any kind of health? Okay. Wonderful. Good. I thought it was going to be the other ratio. I didn't know what I was going to talk about, but okay, good. We're in the right crowd. I'm just going to go very quickly through the data so that you understand what we're coming from. Basically, we're going to try to answer these questions. Now, all of you have experience in human trafficking, so again, the numbers may be a little off, but at least we'll all be on the same track. Obviously, the big statement that human trafficking is modern-day slavery is very relevant to the topic, and by looking at it from that perspective, we understand why it is so important that we do everything we can to try to bring it into our communities, into our clinical practices, to try to take it away from the underground industry that makes this information so difficult to obtain. It has turned into a multi-billion-dollar industry that is now equal to drug dealing and weapon trafficking. The crime creates 4 to 27 million victims per year, and those numbers are very hard to get to because they keep increasing as we dig more and more and find out that there's more of it around in our communities. There's actual definition, and basically to have human trafficking, you have to have the recruitment, transportation, transfer, or harboring of a person by means of threat or use of force. That's the basic. They asked the question this morning, how many of you were in the Oval Theater before this? Okay, so most of you were there. And you heard the question saying, when you have one of these cases and it's sexual exploitation of children, is it usually human trafficking? So to have that human trafficking, you have to have that abduction and coercion. Now, in the case of a child, you don't have to define that because any child cannot give consent. So that automatically goes away, makes it easy to define. The TVPA, or the Trafficking Victims Protection Act of 2000, made it a federal crime. That has helped law enforcement to be able to do some of the things that it does now. And it gives identification of the victims as victims and not criminals. It helps the victim actually rebuild their lives and helps them to get food and shelter and other needs, medical assistance that they need. And obviously it provides that coverage for the victim for all who are children. This is the triad that the University of the State of Florida uses, and you can have any one of these. You know, there has to be a purpose for sexual or commercial or labor. The action of the recruitment and transportation and then by force or fraud or coercion, and the victim is that central point. So this is a good triad to think of what human trafficking is. It's a good picture. Now, these numbers are all over the place because these are the statistics that I got from the U.S. Department of State for Justice in 2006. The numbers have gone up, and today you heard them say that there's about 100,000 that are just children in the United States. So as you can see, these numbers are way off. They're much lower than what we are finding now. A lot of the traffic comes into the United States from Latin America, Southeast Africa, and the former Soviet Union. 80% of them are females, and 50% of all the victims are minors. Now this map, I like it because it shows where, does my arrow show up there when I point it? Yes. Yes. The red and this orange color is where they're coming from. The darker red is the very high numbers of people originating, okay, where the trafficking is originating from. And the lighter color shows that there's not as high number, okay? And then the blues are where they're going to. So you can see they're coming from here, and the United States is the very high number of people where they're being trafficked to. And of course, they also, some numbers come from Mexico and South America. And then in areas like India and Indonesia, you have both coming from there and being used in that area also. So this gives you a good visual picture of where the trafficking is coming and going. Now, how does it work? You have three main characters in this picture. You have the recruiter, who usually gains the victim's trust and then sells them to a camp or an organized group. Sometimes this can be a friend, it can be a neighbor, it can even be a family member that actually coerces this person into believing that they're going for a nice job in the United States. Then you have the actual trafficker, who's the one that controls the victims and makes the victim fearful, who uses the abuse, the threats, and sometimes lies to gain the power over the victim. The victim, who could be anyone of any age. And then there's a fourth piece here that's very important, because without this piece, the trafficking would not work, and that's the consumer. That's the one that pays for either, minors, to have sex with minors, or pays for the brothel homes or the dances. So without this consumer using these goods and services that are being provided, the whole chain would fall apart. And in some countries, like in Switzerland and some European countries, that's where they're focusing their efforts to try to break up this whole vicious cycle. How can we tell if the situation is human trafficking? Okay? It's very difficult to do that because victims will not identify themselves because they live under constant fear. When they take one of these kids, it takes about a week. And what they do is they take that child, and for a week they're gang raped and beaten and almost starved to death. And within 1 week, that child or that woman or that person has completely lost the will to live, and they become a slave to that trafficker. They will do anything they say, because at that point they have no reason to live. They have no reason to fight. They keep them secluded, away from all forms of contact with anyone else, from the public. We've seen all the stories already in the news about the cases where the girls were held within a neighborhood. So these things are happening around you, where you live. If you think they're not, we're just not looking, because they are. They force the victims to be happy and tell them what they want to say. And many people do not know anything about human trafficking, and they don't report some of these events that are going on that they see happening because they don't recognize it. So that's the purpose of having these lectures. That's the purpose of bringing this out to folks, so that the medical community and just the regular business community can identify and see things that don't look quite right, and they can then report it and get investigated. Here's an ad about what happens, so kind of get the message out abroad. A man, this is Maria, who lived in Johannesburg, and they offered her a job as a waitress. So she was very happy to do it. She accepted. Sadly, when she arrived to her destination, there was no such job, and instead she was beaten and forced into prostitution. Another thing that they will do is that they will also, I'm going to skip this next video because it just shows some of the advertising that happens. They also will threaten, if you have victims back at home. One of the things that's happening in South America right now is that a lot of the gangs, the drug gangs that are controlling these countries right now, know people. And so once they traffic them, they know where they live, they know the village they're at, and they say, if you do anything to escape, or you do anything that you're not supposed to, we will kill your sister, and we will kill your mother. We know where she lives, this is her address, and so the victims are not only fear for their lives, but they fear for the lives of their loved ones that they were supposed to have come over to help bring money back home for. So again, the numbers are way below. Over 50,000 women and children are brought into the United States. We know those numbers are much higher. On the West Coast, Portland, Oregon, July has been identified as Human Trafficking Awareness Month. The Department of Justice has declared Portland as one of the 12 U.S. cities, major cities, where it's a huge hub for child trafficking. And why? That's because there's 2 interstate highways that intersect, and there's very few resources for homeless youth. So there's a lot of homeless youth between California and the West Coast. A lot of kids go there, they run away, and so they fall victim to human trafficking. It's the fastest growing criminal enterprise right now. And I have a story here, Emma, who shared her experience in spending 3 years as an enslaved domestic servant in West LA. She was living in a home, taking care of children for a pretty affluent family. And again, she was forced to live there and really shared a horrific story. And she spoke out about it and helped to put the man the owner of the home, in jail. Los Angeles is one of the top 3 points of entry into this country, and for victims that come, because it is a large, sprawling city. There's a very diverse community, so it makes it easy to hide, and there's lots of places for them. It makes it very difficult for law enforcement to come in and actually do inspections or do anything. And they estimate that there's over 10,000 women that are being held in Los Angeles underground in brothels and other places. So we basically talk about 2 forms of human trafficking, either for sex or for labor. So these are the common forms of sex trafficking. You can have street prostitution, the exotic dancing bars, strip clubs. Lots of Latino cantinas are opening up. I bet you as I say that, you can think of 1 or 2 cantinas that you've seen pop up around your neighborhoods. There's lots of Asian massage parlors. I know you've seen those. Brothels, sometimes right in a neighborhood. I found one that had been in my neighborhood. I live in a historic neighborhood in Palm Beach County, less than a half a mile from Palm Beach. Yeah, where the Kennedys, you know, it's pretty wealthy over there. I'm on the other side of the tracks, the other side of the Intercoastal. Right, Russell? Russell's been to my home. Well, right down the street from me, there was a little house, cute little white picket fence, the whole 9 yards. Okay? It was a sex brothel. The whole coming in and out of the house in the middle of the day. The windows were boarded. Never saw anybody coming out of the house. But it never dawned on anybody that that was strange. And women were being held, 6 women were being held in that tiny little house, having sex with these men coming in. And then there's escort services. You can go on Craigslist, right? How many of you have been on Craigslist looking for, no. How many of you have been on Craigslist? Okay, very easy to do. You don't have to have an account. You just go on there and find anything you want. Okay, then some examples of labor trafficking. Domestic servitude, restaurants, industrial cleaning, construction, migrant farm workers. Wendy's going to talk a lot about that. See, I just changed her name. I do that to people all the time. Migrant farm workers, and then there's peddling and begging. So maybe one of those guys, those little homeless signs on the corner, might be someone who's doing that under trafficking. This is my story in Palm Beach County. Okay, Florida has emerged as a major hub of human trafficking in the United States. Why? Because we have all the ingredients. We have the hotels, we have the migrant workers, we have the sex demand. It's all here in Florida. More jobs in Florida, right? It's a good place to come work. Well, it's a good place for people doing illegal activities also. And we had 2 sisters that were dancing at this little club right here in the middle. They had been brought in from Guatemala. These were the proud owners of these establishments. These guys are still in business today, even after the case was prosecuted and found the person who was actually holding them guilty. But the owners, not only were they not charged, they have bought and opened new clubs in Lake Worth, and they're making lots of money off of it. So, I'm sorry, I said they were from Guatemala. They were from Honduras, okay? They were told, there was 2 sisters, they were brought over at the same time, and they were told that they were coming to clean homes and take care of children. When they got here, their immigration papers were taken away from them, and they were forced to dance at these clubs until they made up for their the cost of bringing them over. They were also told where their families lived, that they knew where their families lived, and if they did anything, they would kill the mother. And another sister that was still at home in school. Their idea was that they were going to come work, send money back home for the sister who was still in school, and help the mother and everybody else in Honduras. So they just found themselves in a nightmare, unable to get out. Until the one sister arrived at our maternity clinic, at our health department. She was pregnant, thought she was pregnant. But she was brought in by her captor. He was very demanding, and immediately, a good public health nurse, just as a good nurse, she felt something's not right here. She thought it was a domestic violence situation. Now, he would not leave, so it's always a tricky thing because you don't want to scare them away. You don't want them to get out and run, because if you think something's happening, you want to help them. So what she did is she asked him to step away while she did the physical exam. He stood outside the door. The moment he got out, she started talking to her, said, yes, you are pregnant. I think that you're in a dangerous situation. The moment she said that, up to this point, she had not been looking at the nurse. Okay, her gaze was down, and she did speak Spanish. The nurse spoke Spanish, so she was able to talk to her and get her confidence. She admitted to her that yes, she was afraid for her life, but that she started shaking, uncontrollably. She couldn't stop shaking. So what they agreed to do was to to get her to come back for a follow-up appointment. She said, "Do you think you can come with somebody without him?" And she said, "Maybe." So her plan was that she ended up coming back with her sister. And once she was away, we have a Healthy Start has visiting nurses. The nurse went out to her address that they had given. She met with some resistance, but enough to know that something was going on. And so we contacted the hotline and was set up then at this follow-up appointment where the authorities then were able to provide safety for her in exchange for them testifying against her captor. The captor was arrested and was charged, but like I said, the owners of the club and everything else are still making business in Palm Beach County. These are, very common. They don't speak English. They're unfamiliar with our customs. They're certainly unfamiliar with our laws. They don't trust any outsider. So we were very, very fortunate to be able to make that rapport with that nurse. Now, what is it? What advantage do you have with a pregnant woman that you don't have with anybody else?
She needs medical attention. She's pregnant.
But she forgets about herself for a moment, and her number one concern was that baby. She was afraid that they were going to sell her baby. Because think about it. They could have gotten rid of her, which is what the traffickers do. When they don't need the person anymore, they either get sick or they're not useful to them anymore. She was pregnant. She can't continue turning tricks if she's pregnant. They get rid of them. They're considered like trash. So why did that guy bring her in? Probably they were going to sell the baby because they could have made money on that. Then they would have gotten rid of her or they would have kept using her. So that fear, that mother instinct is what saved her. And she saw that baby as her salvation. Actually, she saw it as God helping her to save herself and her sister. So we were the ones that got lucky in this, because otherwise she would have never told, she would have never talked. Sometimes they blame themselves, okay? And because they've been beaten and raped and their situation, it still might be better than where they came from. You have no idea what their life was where they were living before. And of course they're unaware of their rights, and they fear, like I said, for their safety and their family's safety back home. So there's 4 general areas that the victims need. Immediate assistance, mental health. Well, that goes beyond saying, right? How do you rebuild your life after that? And Wendy's going to have some stories. She has a book that you all need to read and take home with you. And they obviously need living assistance and then lots of legal help in terms of immigration. These are some of the questions that you can ask. All these things are some of the red flags that you can think about. Think of kids that all of a sudden aren't in school. What's a child doing outside of school during the day? And of course, there's the telephone number that we should all memorize. Say it with me.
1-888-377-888.
888-37-37-888. That's easy to remember, right? Piece of cake.
Okay. Now, I know the health professionals in the room would like nothing more than to be told what physicians need to know from a lawyer. So forgive me for the audacity of that. The reason for that is because I've been doing a lot of work with medical professionals. As I mentioned, I direct this medical legal partnership, and so the idea is to really get attorneys and medical professionals talking, to get social work on board, to get nurses on board, to get public health specialists on board, and really to be providing holistic care to victims of human trafficking. Because as you can see, there are legal needs, there are mental health needs, there are social needs, and to just come at it from one angle, it's insufficient. We're not going to be able to really provide the kind of wraparound care that we need to do. So what physicians need to know. We've been working on this with our partners at a community health organization that we work with. As I mentioned, my job is to teach law students and to provide free legal services for patients at a community health clinic. So these are some of the lessons that we've gained from representing victims of trafficking who have come into that community health clinic seeking medical attention, not seeking anything to do with their situation as victims of trafficking. So in terms of looking at the Florida law, some things just to remember is that there could be a number of patients in your practice who could be perpetrators or victims. And they could have medical issues either way, but important to recognize could be coming from either side. And just for you to know how to provide correct screening and resources. It sounded like, Dr. Alonso, your nurse was able to recognize warning signs even without maybe particular training in human trafficking. She said, oh, this sounds like a domestic violence situation. And I'll provide some information too about intimate partner violence and domestic violence because a lot of the warning signs are very similar, especially when you have a pimp or trafficker living with trafficked women, when you have an instance of sexual violence. As far as I'm concerned, we make this delineation in the law between children don't need to show coercion. So if a child under 18 is induced to perform a commercial sex act, that's trafficking. We used to call that a crime, we called it prostitution. Now we look at that child as being a victim. The law gets a little bit fuzzy when it comes to adults, but when we're looking at what are the signs of trafficking, they look very similar to the signs of domestic violence or the signs of IPV. Physicians are important in identifying human trafficking. Again, you must love hearing this from me. But basically, as Dr. Alonso mentioned, perpetrators will sometimes take their victims for medical exams in a system or allow a victim to seek health care. We found one of the few windows for opportunity is when victims are allowed to attend church services, which is why I thought I saw Terry Coonan in the back here. I used to work at the Center for Human Rights with Terry Coonan. We did a lot of education around the state at churches and faith groups because this is a place where it's important for people to be educated about human trafficking. It's one of those rare opportunities where sometimes victims of trafficking are allowed to go and attend a church service or are allowed to go and seek medical attention. Because if they're seeking, they might be seeking medical attention because they're not worthwhile to someone anymore, they can't sufficiently work, so they'll let them seek medical attention. Good Samaritans might see a trafficked person who has a medical condition, take them to a doctor. And sometimes, as I mentioned, medical personnel are the first people to see a victim. And there's good information out there about how emergency room physicians or family practitioners should react when dealing with victims. Again, victims will say that their doctor is one of the few people they trust to disclose sexual abuse. So that question of trust, I mean, that's something when working with victims of trafficking, it takes a while to build. I look a little bit young for my age, and I remember having a few of my clients mention to the social worker who brought them in Spanish, not knowing that I spoke Spanish, saying, what's this like little gringo over here gonna do for me? And I'd have to say, no, in Spanish usually, no, I'm your attorney, and I'm here to help you. But it took a little while to figure out, seriously, I mean, and so it would take meeting after meeting after meeting for someone to eventually disclose what was going on with them and to disclose their full story. A health professional is in that unique position of trust where you're coming, you're seeking medical attention. And so you have that feeling that that person is already there to help you. They're not interested in judging you. Whereas with law enforcement and lawyers and other professionals, sometimes it takes a much longer time to build that. So what can you do? Things you can say is just to listen and say, I believe you from the start. That's a great way to open up more discussion. You don't deserve to be treated this way. You're not alone, and there's help available, and we can help you here. So one thing to remember, you're not a service provider, but a link to services. Sometimes you are a service provider. Sometimes you are a link to services. It's very important that we all know the 888-3737-888, because that's the way that you can report trafficking and really be able to access those wraparound services that I was mentioning. Of course, you're a service provider in and of yourself. If you're a nurse or a doctor or a public health specialist or a social worker or case manager, but you aren't able to provide all the services that a victim of trafficking needs. So that's what I meant by that. In terms of mentioning before why we see intimate partner violence, a lot of times when we're dealing with sex trafficking, as the survivor mentioned in the panel this morning, you do see the signs of intimate partner violence first. You do see a relationship that develops where maybe a trafficked either child or older person might look at this as being involved in a relationship, albeit a very destructive, bad relationship, but at first it seems like this is my boyfriend and this is our relationship. So some coercive and assaultive behaviors that you can see: sexual assault, psychological abuse, progressive social isolation. Even the survivor mentioned that this morning, this feeling like when she started prostituting herself, the idea that, well, no one would want to have me now, and people carrying a lot of shame. I've had clients who were forced into prostitution who then really felt like they couldn't go home to the communities that they came from, not only because the trafficker was threatening their family or threatened that they would come after them, also because they just couldn't show their faces. They just felt such a strong sense of shame for what they had done, even though it was against their will, and intimidation and threat. I'm not going to go over this again because we covered it, but I do really like this. We had the Venn diagram before this. We have more of a flow chart. But I think it's useful just to take a look at, because a lot of times people will talk about trafficking, and I feel like trafficking exists at one end of exploitation of other people. And so you do have to have certain elements for it to actually be trafficking. Otherwise, it can just be an abusive situation, a bad situation, but it doesn't always rise to the level of trafficking. So the first part, the process, just obtaining a person. Sometimes people get confused with trafficking. There doesn't have to be a movement of any kind. There doesn't have to be a movement of a person across borders. There doesn't have to be movement from state to state. Forced fraud or coercion is the very important part, that this can't be something that someone just willingly agrees to do. I think it gets a little bit dicey when we talk about our labor trafficking situation, just because our migrant labor workforce, I don't know if you want to get me started on this, but the H-2A and H-2B visas, there's so much inherent abuse and propensity for taking advantage of people within that it becomes a very iffy border between an employer treating an employee badly, maybe not paying them on time, and telling them they'll blacklist them so that they can't come back and can't work in that condition, to trafficking. And it exists along a continuum of really exploiting other people for their work. And so we list, for the purposes of involuntary servitude, debt bondage, slavery, or sex trade. And within that is domestic servitude and begging, as was mentioned before. So I mentioned human trafficking with domestic violence or with intimate partner violence and needing similar responses. And these are the responses that you would have in having a patient-centered practice anyway. The importance of being victim-centered or patient-centered. Knowing that your patient will be reluctant to discuss what has happened to them. The need for confidentiality, the need to be crisis-oriented, and the ability to have safety and safety planning for that particular person. I'm not going to go into the prevalence of IPV, but it does indeed affect younger women more so than older women, and women more so than men. So it is affecting, much like trafficking, more often women than men if we're talking about sex trafficking. I do think it's important to note 1 out of 4 women will be a victim of IPV in her lifetime. And so there are certain aspects of violence against women that have become so normalized. We wonder sometimes, how could trafficking happen? How could this happen? In some ways, we've become so numb to the way that we mistreat other people that trafficking is, again, part of this continuum. But something that we're all here to learn more about, and to learn out how we can root it out in our communities. Again, Dr. Alonso did a great job of talking about the prevalence of human trafficking, so I will skip through that so we have some more time for questions. I do like to just highlight this in terms of who is trafficked. I think the most common denominator between people who are trafficked is vulnerability, and that vulnerability can be of many different origins. Attorney General Bondi talked about the difference between domestic minor sex trafficking and people who come from other countries. I think it's important to note, just first of all, language and the importance of language, and the importance of recognizing that population as being undocumented and not using the term illegal alien. That can be an extremely ostracizing term when used by people. So vulnerability. So you have in the States, you have vulnerable people who's vulnerable. You have children. You have children who've run away from their home because they were being abused, or because the poverty was so severe that they didn't have enough to take care of themselves at home. You sometimes have parents who are bringing their children either into underage employment, or who basically sell their children into the sex trade. And why does that happen? Because parents can't afford to take care of their kids. So you have vulnerability within the US, and we have a lack of sufficient housing for kids that have left home, either because they were unaccepted at home because of LGBT issues, or because of abuse, because of alcoholism. There's a number of reasons. You have people who come from other countries who come here, again, because of vulnerability, because of the promise of a better life, because they have people at home that they need to care for. Most of my clients have been in terms of trafficking, have been sex trafficking as opposed to labor trafficking, have been women, and all of them have had young children at home, and all of them came here because they thought they were going to do something that was a reasonable job. They thought they were going to work at restaurants. They thought they might work at bars. They thought they might do some dancing, but none of them thought that they were entering into a life of prostitution. They thought they were going to use whatever skills they had to support their children back home, because they didn't have jobs back home. Some of them had tried to go to a number of different countries and were still unable to find jobs back home. So it's that vulnerability, it's that need to provide for their children and willingness to work. Again, both U.S. and foreign nationals, this is not a question of people without status coming here and this happening. Sure, it is, but it's also U.S. citizens, it's lawful permanent residents, it's people of various immigration status. All ages in education. I've had a number of college-educated women who've come over from Eastern Europe unable to find jobs. I've had a number of college-educated women from Central and South America who came over and thought they were entering into modeling or restaurant work or au pair work, and ended up in a situation very different than what they thought. And even though I don't personally have clients, actually I have clients who have been men and who are in the agricultural industry, actually in Boca Raton. We did a big case up there from the Philippines. So men, women, children, there was a lot of focus on children this morning, and I obviously we're coming from a DJJ perspective, and I think that's very important. That's actually kind of where my research is focused on, is children and immigration. But we have to remember that after kids turn 18, there are people who entered into the commercial sex industry, at 17, and then at 19, we still need to figure out how we can provide for people and what we can do to help them. So who are the traffickers? Dr. Alonso covered this a little bit, but you read through this list, who are the traffickers? Anyone. Anyone. This isn't just mob bosses. This isn't just pimps. We list diplomats on there because there's a major problem with diplomats in the U.S., and some of them have diplomatic immunity, or they all do, but we've been trying to have some cases against them where they're used to situations of domestic servitude, where they bring young people with them, and it could be a fine situation, but sometimes the domestic workers in their situation are badly mistreated, and diplomats have this cloak of diplomatic immunity that we've been trying to pierce in order to protect the people that are coming with them. We did a big case a few years ago that involved the head of the crime family was a grandmother. She was a 76-year-old woman from Veracruz, Mexico, and it was the family business. She had her daughters-in-law and her sons, and everyone was involved in this. So this isn't just, unfortunately, this is an equal opportunity crime. This is people of all ages, of all colors, from all walks of life, who have lost the ability to see human beings as human beings and have started looking at them as commodities. Identification in a healthcare setting. I worked on this is information that's from Health and Human Services, but I talk about this with the doctors that we work with. And it sounds like the public health nurse in your example got this, right? So some clues and evidence of being controlled. If it seems like someone's not really able to speak for themselves and someone's trying to control them. Evidence of an inability to move or leave job, bruises or other signs of battering. A lot of my clients told me that they were frequently punched in the stomach because it left fewer bruises. So fear or depression, someone who's non-English speaking or recently brought to this country. A very important one is when they're lacking documentation. Almost all the trafficking cases I've worked with, folks' passports and other documentation was taken from them as a way to exert control. and to really say, you can't leave, where are you going to go, nobody knows who you are. Dr. Alonso's slide mentioned this, but the idea that people have been taught, they've inculcated this fear of the authorities in trafficking victims who come from other countries, and even who are here, that the police are not going to help you. If you're from this country, they say, you're a runaway, who's going to pay attention to you? Or, you're in prostitution, that's a crime, you're going to get locked up. Or for people who are brought from another country, they just talk to them about, how the police are in your country, you know about bribery, you know about this and that. They're just going to take you and ship you back home, and we know where you live, and then we're going to come get you. So who could be a victim of human trafficking? Again, anyone. Anyone who is vulnerable, is susceptible to being exploited for their work, and viewing it as economic shackles, as Dr. Alonso mentioned, this idea that you're supposed to work to repay this theoretical debt that you owe, especially if you were smuggled into the U.S. So they come up with an insane amount of money that you owe and say, we're keeping the books for you. You'll continue to work this off until it's paid. So traffickers often brutally control their victims. I say similar to domestic violence. Again, psychological abuse, isolation, drug and alcohol dependency. We saw a case up in Palatka with a population of mentally ill homeless persons that a trafficking organization got these, it was all men, got them addicted to cocaine, and then had them working in the fields, and their way of paying them was to pay them in cocaine. Again, just other examples, we've covered a lot of them, of things that people are trafficked into. Just to cover this, because they use different nomenclature, but domestic minor sex trafficking basically refers to kids who are U.S. born, who are induced to perform commercial sex act. So Florida, again, is a magnet for runaways. And as I mentioned, any child under 18 induced to perform a commercial sex act is a trafficking victim. So when I started doing this work, I think it was in 2008, we were doing some training with the DCF hotline, and they were trying to get human trafficking as one of the indicators. And even then, people, even from DCF, people very well-meaning, just really didn't understand this distinction between what's prostitution and what is trafficking. Because the laws aren't clear. And in terms of around the country, very few states have altered their prostitution laws. So states have now created anti-trafficking laws that state this, that mirror the federal legislation that say any child under 18 induced to perform a commercial sex act is a victim of trafficking. At the same time, they have kept prostitution laws on the books that say, only if you're over 16 or only if you're over 15. So we have this disconnect still in our legal system and still in our society, where people look at a prostituted kid as a bad kid, as a criminal, whereas a trafficking victim is someone worthy of remedies, worthy of attention, worthy of therapeutic care. So I think we still have a long way to come on this issue, but DJD is doing some excellent work. Application of cultural competence, again, listening to the patient with an open mind, without using culturally based assumptions, as I mentioned, referring to an undocumented child or adult as an illegal alien is bound to ruffle some feathers. Letting a patient narrate their own story, and making sure that the interpreter is not linked to the trafficking situation. This is really important, especially if you're dealing with a language not like Spanish, but we recently had a young girl from Guatemala who spoke only Acateco. It was very hard to find an Acateco interpreter. We eventually found one through a language line, but when we tried to get a local one, we were a little bit concerned about that person and their relationship to them. It's just important to consider for that person in that situation to kind of put yourself in their shoes and think about what is it like for them to talk about this problem. Are there barriers to their safety? And Dr. Alonso covered these actually in terms of questions to ask. So I don't want to repeat them, but we can make them available to you if you're interested. And just a little bit before, Dr. Alonso mentioned that I wrote a book. I'm really, really passionate about it. As I mentioned, I work in a law school, so we have to do a lot of academic writing that only other law professors read. And so I sat down one day to write one of these esoteric pieces, and I just got really fed up with it because I realized what I wanted to do was tell my clients stories and make sure people understood what their lives were like before the trafficking, what was the vulnerability like during the period of trafficking, and then after. There aren't, I mean, there's movie Taken out there, but there aren't a lot of really accurate depictions of what trafficking is like and what happens when their lives go on, when people try to repair their broken lives and move forward. So I wrote a book, and it's 3 women's stories, each told from their first-person perspective. 2 are victims of trafficking. One is kind of an iconic victim, one is a little more mixed, and the 3rd person is a public interest lawyer that lives in the Florida Panhandle. So that wasn't a real stretch for me, but I do think if you have people in your life that don't know a lot about trafficking, that it's a good read. It's a novel. It's not academic, and I'd recommend it. I'd be happy to. I have a teacher's manual, so they're using it in classrooms now.
So the name of the book?
The name of the book is called "This Is Our Story," and the author is Wendy Adelson. Okay, so just back to health indicators, sexually transmitted diseases, people who have pelvic pain, urinary difficulties. Pregnancy, again, is a great way to get someone who's really lost the ability to care for themselves, but will care for that unborn child. Yeah, chronic back pain, eye problems, malnourishment, and then infectious diseases. Again, I don't need to read through all of these, but a big one to think about, and when I was just talking with, is anyone here from Christie House? No? I was just talking with someone. Christie House does some unbelievable work with Project Gold and providing housing to victims of trafficking. They were talking, I was talking with Mary just about trauma and the need for people to be trauma trained. So, you know, we talk about telling their story, and I am not trauma trained. I tried to be very careful and tried to make sure my clients didn't have to tell and retell their stories, which can be traumatizing. But just, oh, I wish we had more people who were trauma trained and had the ability to provide mental health counseling, just because of the psychological trauma, depression, stress-related disorders, panic attacks, feeling of helplessness, shame, humiliation, denial or disbelief, culture shock. I've seen all of this in all of the clients that I've worked with. And I've tried really hard to find them mental health counseling and to find people who will do that. I've really done it on sort of a one-on-one pro bono basis. I found someone to donate dental care, and I found someone, you know, here and there, I've done a lot of translation, taken my clients to doctor's offices and translated for them if someone would provide a service. And I've tried a little bit throughout the state to create those networks, but I know that people exist to provide these services, even if they're not services that are being provided for. I know there are professionals around the state, probably that you know. So I would love to see when we're at a statewide meeting like this for there to be more connections statewide on, you know, can we get a list of dentists around the state to provide services? Can we get a list of OBGYNs to provide services? I'd really love to see that kind of care provided for victims of trafficking in Florida. A little bit about mandatory reporting. I don't think we have a lot of law enforcement here. So I'm gonna get through, but just to talk to you about mandatory reporting again, the abuse hotline has an indicator for human trafficking. So important just to call in. Their abuse hotline is 800-962-2873. Again, 800-962-2873. Federal laws, I feel like our non-lawyer did a good job describing federal laws. But just, you know, she mentioned the Trafficking Victims Protection Act of 2000. It's been reauthorized several times since then, and provides refugee-type benefits for victims of trafficking. You still have to be a really good advocate for your clients to be able to access those benefits. It's not a simple process, and they really could use someone to help walk them through the process of how to do that. And that's not only because of you know, incomplete transportation in places, but also just people with the ability to communicate if there's a different language going on, or if you're dealing with a child, or even if you're speaking English and you're educated, the process itself is difficult to navigate. So again, I covered this before. So quick and easy next steps. What can you do? I hate leaving people just feeling bereft. The situation is terrible, and we need to do more. So there are great materials available, whether it's through HHS or Zonta in Leon County. There are a lot of great materials out there. I'd be happy to connect you with some of them. So put them in your office, put them in bathrooms, waiting rooms, share materials with all of your staff. And then know your local resources. know who's working on human trafficking. There are task forces in almost every county around. Actually, they gave us that great yellow sheet of information, so it's a good place to start. And I've got some here, but you've got a good bit going.